The worst thing a health professional's ever said to me, was to me and my family really, it was one time we had to call the ambulance because James stopped breathing, and before they took him to the hospital, they asked us, if he stops breathing again, do you want us to save him? And I think that was a really hard question to ask to anyone, but to a family that had a young person. It wasn't an older person who's lived their life, it was a young person who still got their life ahead of them. But it was, I think for me, that was a really hard question, and I just thought, of course we want you to save him.
The worst thing a health professional said to me was, on arrival at the hospital, Sam had a 6-centimetre brain tumour and his intracranial pressure was rising and he was deteriorating rapidly. And the neurosurgeon that met us called his case non-urgent, told me he shouldn't be on call, and he didn't have a plan. There was nothing that was going to happen on the weekend because strange people worked on the weekend, and walked off.
Yeah, my son's journey was a tough one. He had a condition that wasn't diagnosed. He didn't diagnose of cancer. It wasn't. His death certificate says arterial vasculopathy, which is not a disease. It's not a diagnosis. And I'm very mindful that was probably tough for the doctors, that they were. I said to my wife, a lot of times we're finding out stuff probably when they're finding it out as well. But there were some tough conversations along the way, and especially at hospital, because Rio was presenting in some different categories of fields in medicine. And there was a few, I suppose, fields where doctors were probably not talking with each other. And the vascular team talking with the renal team and all these different things that we were engaging with. And it was really tough when I was getting some mixed messages at times. And that's a tough thing to have. I had one doctor trying to convince me that, no, he's fine. He'll be, he had a second amputee. The first amputee, I should say. And then, he'll be fine. Well, what's the issue? We'll look over that. And then I had another doctor saying, look, I don't know what's going on here. And he developed gangrene. And that was a tough thing. I had to watch a doctor, and I don't speak about this a lot in my process, and I don't want to get emotional about it, but I had to watch a doctor pretty much the night before. They said his whole leg's gone gangrene. We don't know what to, and he pretty much got like Benadine, and he shoved it up my son's leg. And to watch my son yelp, my wife wasn't there, and he was just looking at me going, Daddy, what are they? And I always remember that yelp where he was just in so much excruciating pain of that being shoved up his leg.
When Marcus first started seizuring, he was doing all types of seizures, and it was something that not many Black people had seen. Like, he would go from one into the other, and we were trying to figure out what medications to give, and he would go unconscious and limp, and it was quite scary for me at the time because I'd never had to deal with seizures before. And there was this one doctor that came in, and the nurses had actually called him because he needed Medaz because he'd been going for longer than five minutes. And he looked at me and he said, a minute for you seizuring is scary, but I get scared around an hour. And I thought, any seizure for any parent is scary. How dare you? And I didn't even call you in here, let alone have you talk down to me.
I'll never forget, after being in there for, would have been a week and a half, maybe 2 weeks, and Mark was just declining further and further. And every day there was something else. He was on so many antibiotics, like really heavy duty medications, to try and just work out what's going on. Why is he crashing? Why are we not seeing improvement? And he started to retain and not retain and have a distended bladder. And I'll never forget the ward nurse, who was amazing and just really understood Mark and us, wasn't able to get the catheter in. Another nurse tried and wasn't able to get the catheter in. And so they had to call general surgery. This surgeon walks in, and I don't think she realised I was the parent. And she basically says, who's this kid that I've got to go see because he's not then you're not able to get a catheter in him, like really disgruntled that she's had to stop what she was doing and come in to alleviates significant pain that my child is going through, not being able to pass urine and with the distended bladder. And I just remember after everything we'd been through, and the nurse at the time looked at me, because my face must have just changed. And she said a few other things, and I can't remember the exact wording, but it cut me so deeply that someone who's in the profession of caring and treating and looking after children can have that response and also speak so horrifically to other colleagues. I just remember going, you are not stepping foot near my child.
The worst thing health professional said to me is, you don't have cancer. And then they basically said, and then they didn't look at my scans, so they had no idea. It made me feel like, why are you here? You don't need to be here. He said it with such anger and like disgust in his voice, and I'm just glad that I had the initiative to say I want a new doctor.